Continuing our coronavirus watch, as we mentioned at the top of the hour, Jackson County Public Health is now investigating 2 new workplace outbreaks of the coronavirus.
Earlier today, Newswatch host Brian Morton spoke with Public Health to get a better idea of what this means for our local virus trends and reopening progress.
Now, what can you tell us about those workplace outbreaks? Should we be concerned?
We have workplace outbreaks frequently. When they're in small businesses, they don't get reported to the public unless there's something of specific concern. So having a couple of new outbreaks is not unusual for us. Obviously, we'd like to see those be 0, but no, they're not terribly large, and I don't see this as a trend in particular.
Well, while you mentioned trends, what are you seeing in terms of our case numbers? Has it been fairly steady, or are we seeing some erratic numbers out there?
The numbers are not entirely stable. For example, I think we had about 40 some odd cases the last few days. And then prior to that, we were in the single digits. So we have to sort of see how these numbers play out. One of the things that happens with an outbreak is you end up doing a lot of investigations and you find cases. So that may be why our numbers are up a little bit over the last couple of days. In general, if you look back over the last 2 or 3 weeks, we've been trending downward, and we are, last time we put all the numbers together, we were fairly far below the extreme level. So we're solidly in the high-risk category.
You mentioned something interesting, that when you see an outbreak, you do more testing. Does that mean those lower numbers don't necessarily indicate the true level of virus in the community, or is this we just haven't found the folks that may have been affected by the smaller total?
Yeah. Well, that's always true. I mean, we're only testing probably a small percentage of the people that truly have the virus, either because they're asymptomatic or they don't want to talk to us or they have mild symptoms or what have you. The other thing is that the data will fluctuate in part because of what gets reported back from the state. So there's often a little bit of a lag time. But in general, if we are pursuing an outbreak or multiple outbreaks, as we start to call people and let them know they've been in contact, we start uncovering more cases. So anytime we have an outbreak, we're going to add a few more cases to the list.